Namaste. I'm very pleased that this conference, although we timed it in less than 100 days, have had the privilege of attracting probably the most important people from around the world. We thank the several ministers who have come from, health ministers from several countries, the scientists, the speakers, and most importantly, the people who made this all possible. The four industrial bodies, CI, FICCI, ASSOCHAM, and IAMA, as well as the knowledge partners. We thank particularly each one of them, the Bain, the McKinsey, KPMG, and PwC, for having brought these collective thoughts on dealing or how and why we can find solution for this huge problem. First, we are very grateful that we have with us none other than Dr. Montek Singh Ahluwalia. We all know him as the economic liberalization of the country, as the finance secretary at that time. But now, for the last decade, he has been in the Planning Commission. In many ways, there has been a significant impact in the policies that they have pronounced, and what really he said is the success is when he sees the implementation right. And this morning we discussed about the healthcare. One of his colleagues, Saeed Ahmed, said, we wish we had given 3.5% of the GDP, but we'll have to look after all the sectors, and then still that 3.5 sector, she asked Dr. Srinath Reddy, you can still get it from others. But we thank the liberal attitude and the liking you have for healthcare, Dr. Montek. We are privileged to have Honorable Lord Nigel Crisp. You heard him. You heard him because he has all his thoughts and experience of handling one of the largest healthcare services in the world, the NHS, both as the CEO and then later on forming the policies of the British government as the Permanent Secretary of Health. We thank you. We thank you for sharing those 5 brilliant way forward for us to assimilate, and also accepting to be part of the Senate that we have created so that the suggestions that are made today are being followed continuously. Of course, Srinath is part of us. Dr. Srinath Reddy, he's, I would say, even in the Healthcare Alliance, whatever has happened, he has played at every time what could be done, how could we shape this better, who would be a better contributor for each one of this. Thank you, Srinath. But your contribution, Public Health Foundation, is immeasurable. And we're also proud that you are the first Indian unanimously to be elected as the President of World Heart Federation. All our congratulations to you. Apart from your interest in education, being the chairman of national boards. Dr. Love Verma, we heard you. We heard you talking about the government, Ministry of Health, what it has done in the last decade, the various sectoral improvements that has happened, the 4 thoughts that we have in furthering the health outcomes in our country. But more importantly, I think when you said that all people will have health checkups, I think that's something which is very pleasant to all of us. That's really one of the major steps that we're going to talk about as we handle these major problems. Someone asked me, why are you doing this? Why is this such a crisis? And why do you think you can achieve your goals? I'm going to leave, I won't answer this. I'm going to leave this for you. After 2 days of deliberations, the work that has been put in by the several people in the last 100 days, how they brought these documents together, we want you all to go through those documents and see that each one of these, if you see this morning, the deliberation that took place on NCDs, Dr. John Brooks talked about the diabetes and the contributions of Jocelyn and the way that what we should look for saying, can we make diabetes disease free? And what are the steps that we need to take in that direction? The heart disease, of course, is something which we have not seen. As medical students, as practitioners of medicine, we have never seen 30-year-olds get heart attack. This year, in Apollo, we have seen several hundreds of people who came in 30s with a heart attack. Some never reached us. Similarly, in the strokes in 40s. So I think this is a huge problem. We will, at the end of the 2 days delegation, form these clear guidelines as to how we take this back, heart disease from 30s to 60s, and not sudden death. And finally, on cancer, I'm happy that we could conduct a cancer conclave exactly 4 weeks ago, 4 weeks in first week of Feb in Chennai. Who is who in oncology from around the world were there with almost 2,000 delegates. But what really we talked about was not about saying what are the newer technologies to handle cancer, but the prime thing to saying how can we alter this huge disease burden in oncology. So we call that conference, at the end of it they call it saying cancer conquerable. Can we say this? Of the infections of the heart disease and the diabetes, saying that this 4 days, 2 days dialogue and the work that has gone behind this by the knowledge partners will take us towards that steps. And especially, I'm not fond of this, I must say this, and it is true. Whatever we innovate in India, I think it's an innovation which is probably, if it's right for us, is right for the rest of the world. For two simple good reasons. We have this disease, and we have the burden of the disease along with it, the cost. We're always conscious saying we need to have quality in healthcare, but we're equally conscious saying that we must make it cost effective. This is what we have done. I must say, when I started Apollo, my vision started because I lost a young man who couldn't go to Houston for surgery because he couldn't raise $50,000. When we started heart surgeries in 1983, we decided, the first year we did 200 surgeries at about cost of around $3,000, and our success rate was 90%. Last year, we charged less than $3,000, maybe $2,500, but our outcomes were 99%. I think this is what Dr. Nigel Christ clearly said, that if you improve the quality, you are automatically reducing the cost. You are removing the waste in healthcare. I think this is the formula that in all of tackling these 4 diseases, and it's just not the 4 diseases. She also talked about the CCI, chronic diseases, and the injuries, which Dr. Bhaktavasalam pointed out. It will be our focus during the course of these 2 days. I'm confident that when we are here, if India can do many things, especially in space, when they went to the moon, Chandrayana, now attempt to go to the Mars, all of this clearly demonstrates that if we have a clear vision and a purpose, we can achieve this. This is where I believe, huge as the crisis may be, the bigger is going to be the problems that we will have, but certainly I think we will come out with clear guidelines as how we would tackle these 4 diseases. The purpose is very clear. The papers that you are all receiving clearly demonstrates their thought processes. They're going to tell how we are going to proceed in controlling each one of these problems. But most importantly, I think we formed what's called the steering committee. I'm happy that Dr. Nigel Crisp and several others who have already accepted to be part of this. That steering committee is going to negotiate and steer, saying, where are we in this, so-called problem-solving or crisis-solving thing, and where can we make the differences in this? And I think that steering committee will make a very significant difference. I'm going to closely follow them, but I have something else. I'm going to follow it in a different way. I come from a village in, the most backward of the districts, a small village called Arakonda. Even drinking water is difficult there. Even bore wells are drying up. In that place, I thought we would have adopted 70,000 children from 62 villages. What we plan to do for them is to see how do we take care of from birth to the last breath. So we have adopted that 70,000 in all these age groups, and now trying to formulate several schemes to see, for example, to look after the newborn, I must look after the mother. There are already several formulas that, maternal child welfare. How can we implement all that's been taught to take the plans into action, I think, and how do I carry this child till he starts going to school? What do we do to not just the physical health, what can we do for mental health? What can we do to prevent disease? If they have, how do we treat them? What do you do for them after he has been cured or out of the hospital? So I think many of these will come. We're going to request any new thoughts that can flow in, and certainly the various formulas that have been designed during the course of these discussions will be part of it. So I will be able to clearly monitor from there, where the steering committee monitors these various suggestions. Finally, I only want to say a big appreciation for this, the provoking thing. I must do something for this. We must avoid this huge crisis. If we have done it, as an Indian sometimes, I feel proud to look back and say, way back, the surgeries were done in India, anesthesia was given, pharmacopoeia was described several hundreds of years ago. If they can do it then, I'm sure we should come out with the help of the people around the globe. And what we develop is not for us. We are going to share it and give it for the rest of the people, and so that we become part of the global health problem. I again want to say, if I don't say a word, for all the people who are behind me or in front of me to make all this possible, it's just wonderful. I think it's very joyful to think, saying, we are here to make that big difference. We will see what necessary steps that we need to take to prevent the NCDs. What should we do to utilize the new technologies that are available in transforming healthcare? How can, as I see Dilip Sanai walking in, what can we do to upgrade the skills of our people? We are proud that we have the largest number of young population. How can we use them? How can you use many of them into healthcare, and probably say that Indian healthcare has largest number of skilled people in this who can make people healthier and happier. Thank you all very, very much.